Dr. Bejar, which genetic mutation and cytogenetic changes are associated with a less favorable response to MDS treatment?
Yeah, thank you for that question. It's one that often comes up in our risk assessment of patients with MDS. About 50% of patients with MDS will have chromosomal abnormalities. A small number of them are actually considered favorable, but the more chromosomal abnormalities that a person has in their MDS cells, the more likely the disease is to be aggressive and to be more difficult to treat. There are certain specific abnormalities that are particularly poor risk. For example, the total loss of chromosome 7 or deletion of part of chromosome 7 is considered a poor prognostic marker, as are a few others. But in general, a person who has one or no abnormalities tends to have a better prognosis. In particular, we look at the presence of individuals who have multiple chromosomal abnormalities as being at the highest risk. So 3 or more or 4 or more are considered are high and very high risk for chromosomal abnormalities. Now for genetics, it's a little bit different because it depends on the individual gene. There are certain gene mutations that are typical of MDS, but don't necessarily change its outcome. We consider these to be neutral. A couple of examples would be genes like TET2, for example, or perhaps DNMT3A. Then there are mutations that are associated with a more favorable prognosis, as Dr. Santini answered in an earlier question, like SF3B1 when it's present in isolation. But for the most part, every additional gene mutation is associated with a higher risk in MDS, particularly mutations in genes that we associate with a very poor prognosis, like mutations in a gene called TP53. TP53 is a mutation that's associated with resistance to treatment, rapid relapse, and unfortunately, relatively poor overall survival. So it's important to understand these genetic mutations to be able to do an accurate risk assessment and understand which genes are favorable, which genes are neutral, and which genes, like TP53, tend to confer a worse prognosis.